You are most welcome to our podcast. This podcast is brought to you by Ecological Christian Organization in partnership with Marathon Advertising. And the purpose of this podcast is basically to bring experts from different sectors and areas to share and discuss the experience in relationship to climate change, on how it's affecting them and how it relates to their sector. For today's topic, we shall be discussing the nexus between climate change and the sexual and reproductive health. And here with us in the studio, we have our colleagues from Reproductive Health Uganda, who will be introducing themselves later. But to give you some kind of background, you know that we are currently living in the climate change crisis, and you are aware that if we do nothing, then the cost of inaction is quite high. And it is upon this background that Ecological Christian Organization, in partnership with the Marathon Advertising, started this initiative with the aim of mobilizing other stakeholders and partners to take action, because climate change is currently one of the biggest challenges of our time. And it's because of that we shall be discussing this topic, which relates to sexual and reproductive health, and how those who are in this sector, the practitioners, for this matter, our colleagues from Reproductive Health Uganda, who are very key in this sector, on to share with us some of the challenges they are seeing, how their programming integrates climate change issues, what are their plans, what are their challenges, what are their calls to action, and definitely how we can work together to advance this issue, because we need to work as global citizens, but also as people, because we live in one global village, so that the actions of every individual, every institution contribute to either building resilience of the communities we live with, or it moves us towards mitigation in terms of handling or addressing the issue of climate change. The linkage between climate change and sexual and reproductive health existed and has been existing for years. It has been there. Many communities have been facing this challenge, but some of the impacts have not been well amplified or have not been well understood. And today we shall be discussing to really understand those linkages, so that we are able to appreciate the magnitude of the problem, as well as, of course, designing strategies on how we can be able to address or contribute towards move towards the solution. The Paris Agreement, which was signed in 2015 in the city of Paris in France, is the basis for the current climate regime. And the commitments in there include a number of climate-related issues. But for today, we want to explore how climate change relates more with health, and specifically sexual and reproductive health. You find that many girls and younger people are affected by the climate risks in different areas. We see that we are experiencing floods in different parts of the globe. Right now, the floods in Pakistan has killed so many people. We find that in the Horn of Africa, because of drought, sometimes people also die, including their livestock. You find that in some areas, people don't have access to water, and they can't do productive work. And we know that access to water also is very key in promoting hygiene, and therefore water is a very critical component with when we talk about sexual and reproductive health, because without water we can't cook the food we are talking about. We can't have can't talk about nutrition. We can't talk about good health in general, and therefore we believe that this is a very critical issue. We celebrate the fact that during COP28 in Dubai, health and climate change was put on the agenda of the United Nations Framework Convention on Climate Change. And this gives us an opportunity to discuss and be able to make sure that we feed into that agenda. However, we need to see how this cascades downwards in terms of the grassroots movement building, because without action at the bottom level, then we may not be able to do much at the higher levels. And this discussion is a part of the grassroots mass mobilization or movement building that will lead us into action. But also we need to be able to amplify how girls and young people are suffering from the impacts of climate change, and from the perspective of sexual and reproductive health.